Hi, my name is Bree Cowart. This is for class nursing 7348, and this is my presentation on Alzheimer's disease. So what's the etiology? Alois Alzheimer was the first German neuropathologist in 1906 that first described Alzheimer's. It's a progressive degenerative disorder of the brain. Alzheimer is not a normal part of aging, and it is one of the most common causes of dementia. Dementia is a broad term and has several different types. Dementia is a general term for memory loss and other cognitive abilities serious enough to interfere with daily life. Alzheimer's disease accounts for about 60 to 80% of dementia cases. So what are the risk factors? The number one is increase in age. The next is family history. They've also found that genetics can play into getting Alzheimer's. If you're autosomal dominant trait and it's linked to 3 genes with mutations in chromosomes 21, 14, and 2. A head injury, and there is a heart to head connection. Because the strongest evidence links brain health to heart health. This connection makes sense because brain is nourished by one of the body's most richest blood vessels, and the heart is responsible for pumping blood through the blood vessels to the brain. The risk of developing Alzheimer's can be increased by many conditions that damage the heart and the blood vessels. This includes heart disease, diabetes, stroke, high blood pressure, and high cholesterol. So your brain is like a factory. Microscopic changes in the brain begin long before first signs of memory loss. The brain has 100 billion nerve cells. Each nerve cell connects with many others to form communication networks. Groups of nerve cells have special jobs. Some are involved in thinking, learning, and remembering. Others help us see, hear, and smell. To do their work, brain cells operate like tiny factories. They receive supplies, generate energy, construct equipment, and get rid of waste. Cells also process and store information and communicate with other cells. Keeping everything running requires coordination as well as large amounts of fuel and oxygen. Scientists believe Alzheimer's disease prevents part of a cell's factory from running well. They are not sure what the trouble starts, but just like a real factory, there's backup and breakdowns in one system causes problems in other areas. As damage spreads, cells lose their ability to do their jobs and eventually die, causing irreversible changes in the brain. The pathophysiology of Alzheimer's includes 2 abnormal structures called plaques and tangles are suspects in damaging and killing nerve cells. Plaques are deposits of protein fragmented called beta amyloid that build up in the spaces between nerve cells. Tangles are twisted fibers of another protein called tau, which rhymes with wow, that build up inside cells. Loss of acetylcholine due to degeneration of neurons. Through autopsy studies show that most people develop some plaques and tangles as they age. Those with Alzheimer's tend to develop far more and in a predictable pattern that begin in the area important for memory before spreading to other regions. And this is an example in this picture of those tau proteins. In the brain, neurons connect and communicate at synapses, where tiny bursts of chemicals called neurotransmitters carry information from one cell to another. Alzheimer's disrupts this process and eventually destroys synapses and kills neurons, damaging the brain's communication network. So they're unable to communicate effectively to you. So here, this slide shows the differences in the brain structure. So here is the brain without the disease, and then here's the brain with advanced Alzheimer's. Notice these structures of it, how diminished and diseased it looks. All right, so here shows the progression of Alzheimer's. And it shows you the earliest stage, which can last 20 years, mild to moderate, which lasts around 2 to 10 years, and then severe, which is 1 to 5 years. Notice at the beginning stages, it affects the hippocampus region, and then as the mild to moderate, it affects the frontal part, and then at the very severe stage, it affects that fully the frontal part of the brain. And then it also affects, your parietal side. It affects your occipital side. So pretty much all parts of the brain are affected that severe stage. But yeah, right here in that mild to moderate stage, there is the frontal region that's affected, which affects their judgment. So what are your clinical manifestations? This is destruction and death of nerve cells causes memory failure, which is the failure to remember newly learned information, personality changes, which affects your mood and the behaviors, problems carrying out daily activities, unfounded suspicions about families, friends, and personal caregivers, and difficulty speaking, swallowing, and walking. So what is the difference between Alzheimer's and typical age-related changes? Alzheimer's, you will have, or dementia, you'll have poor judgment and decision making. You'll be inability to manage a budget, lose track of the date and the season, difficulty having a conversation at times, and misplacing things and being unable to retrace steps to find them. Typical age-related changes include making a bad decision once in a while, missing a monthly payment, forgetting which day it is and remembering it later, sometimes forgetting which word to use, and losing things from time to time. So what are your diagnostics? What can you use to help back up your diagnosis? So the main one that you will be using in practice is your mini mental status exam. This helps identify dementia. So during your mental status exam, a health professional asks a patient a series of questions designed to test a range of everyday mental skills. The maximum MMSE score is 30. The score of 20 to 24 suggests mild dementia, 13 to 20 suggests moderate dementia, and less than 12 indicates severe dementia. On average, the MMSE score of a person with Alzheimer's declines about every 2 to 4 points each year. There'll also be a deficit in greater than or equal to 2 areas of cognition, so confusion with time or place. It's a gradual onset that occurs over months to years rather than days and weeks, and has progressive worsening of memory and other cognitive functions. There is no disturbance of consciousness. The onset after age 40 is usually after age 40 and most often after age 65. There is no systemic or brain disorders such as a tumor or stroke that could account for the progressive deficits in memory and cognition. So what is the prognosis? As of right now, Alzheimer's is the 6th leading cause of death in the United States. The life expectancy is 4 to 8 years after diagnosis. Some people can live as long as 20 years. The number of dementia patients expected to double worldwide every 20 years. It is estimated that more than 35 million people worldwide with Alzheimer's dementia, including 5.4 million Americans. 2 out of 3 of these individuals are women. So treatments include medications. So Alzheimer's, there is no current cure for it, but you can treat the symptoms. Cholinesterase inhibitors such as donepezil, rivastigmine, galantamine, and amenda are used to help prevent the breakdown of acetylcholine, a chemical messenger important for learning and memory. This supports communication among nerve cells by keeping acetylcholine high. Also, antidepressants are used for low mood and irritability, such as Zoloft, Paxil, Prozac, and Celexa. Anxiolytics for anxiety, restlessness, verbal disruptive behavior, and resistance, such as Ativan. And then antipsychotic medications for hallucinations, delusions, aggression, agitation, hostility, and uncooperativeness. This includes Zyprexa, Seroquel, Risperdal, and Geodon. So how can you prevent Alzheimer's? This is one of the new focuses in order to help prevent. And here's a few things that can help. So break a sweat, make sure you exercise, hit the books, stay educated, read more, butt out, quit smoking, follow your heart, be on a heart-healthy diet. Heads up, watch out for traumatic brain injuries. Feel upright, make sure you're on the correct diet. Watch some Z's, make sure you're sleeping well. Take care of your mental health. You want to make sure to not have excessive anxiety or depression. You know, just take care of yourself. Buddy up, be social with other people, and stump yourself. Always do something to help keep your brain stimulated. So what are some evidence-based practice using non-pharmacological therapy? Caregivers play a pivotal role in the evaluation and management of patients with Alzheimer's. Research has demonstrated that a reduction in neuropsychiatric symptoms decreases patients' injuries, hospitalization rates, and caregiver burden. Non-pharmacological therapy, including music, exercise, aromatherapy, and massage, is safe and effective. Short-term outcomes of such a program include increased caregiver knowledge, improved caregiver perceived self-efficacy, and positive attitudes regarding non-pharmacological therapy. Sylvia Barr Center is one of the places that I work, and then a lot of times what we do to help is engage them in different activities. This includes doing exercise groups, having them do games during the day, listening to music, and ambulation, getting them up and walking. That helps a lot with the restlessness and also helps manage their symptoms. So here's a case study. J.A. is an 82-year-old female who was brought in for a neurological evaluation by her daughter because of a 3-year history of memory impairment. She had completed high school and worked as a caregiver up until 2015. She had lived alone and maintained her own home and financial affairs up until the death of her husband in 2010. The daughter had begun to notice gradually worsening memory impairment and difficulty finding words. The patient has become angry at the suggestion that she may have a progressive impairment and experiences occasional periods of anxiety and change in her sleep habits. Other family members have noted a decline in housekeeping and financial affairs, but she has had no complaints. She is a well-groomed woman who is alert and friendly. Her family history includes a maternal uncle who had dementia in his 90s. A medical history of hypertension, dyslipidemia, and seasonal allergies. She has a surgical history of hysterectomy, and she's allergic to penicillin. On assessment, her speech was highly disorganized and paraphrasic, with a tendency to use vague reference such as things and stuff. She was able to provide her name, but when asked about her current age, she says, "I don't know, about 81, I think," and laughed. She incorrectly stated her birth month, but then became aware of this. Given 3 choices, she was able to give the correct month. She was unable to give the year of her birth, the current year, or the name of the current U.S. president. She often would stop in the middle of a sentence and would search for the right word, and would often laugh after forgetting. Routine labs were performed and are within normal limits. A CT of the brain is negative for acute events, but does show chronic frontotemporal degeneration. A mini mental status exam was performed, and she scored a 14, indicating moderate cognitive impairment. The conclusion of the evaluation was that she met research criteria for probable Alzheimer's disease, that she required complete supervision around the clock to ensure her safety, and that she would probably benefit from social stimulation provided by a group living situation. Routine follow-up outpatient was required every 3 months. The patient will be treated with donepezil 10 milligrams by mouth at bedtime and Seroquel 12.5 milligrams by mouth every day at bedtime. So let's do an analysis of this case study. So what are her risk factors? Her risk factors include that she's 82 years old. She's got a family history of people who have dementia. She's got a medical history of hypertension and dyslipidemia. So now, what are the clinical manifestations? She's had a 3-year history of memory impairment with gradual worsening and having difficulty finding words. She gets angry at the suggestion that she may have progressive impairment and experiences occasional periods of anxiety and change in her sleep habits. And there has also been a decline in housekeeping and financial affairs. More clinical manifestations include that she's highly disorganized and paraphrasic. She often would stop in the middle of a sentence and forget the word she was looking for. What are some objective things that we found by doing our assessment? She was unable to give the year of birth, the current year, and the name of the U.S. president. Despite her lab work, everything was normal. Her CT showed some chronic degeneration, which is a sign of dementia, of Alzheimer's dementia. And her mini mental status exam was 14, which showed moderate cognitive impairment. And then what is the treatment? The treatment is donepezil, the cholinesterase inhibitor, and Seroquel, which is an atypical antipsychotic to help with anxiety, agitation, and also helps with her sleep. So let's look at the comparison or the differentials from this case study. So how do I back up my diagnosis? So the comparison, I'd have an increased age. She's got a family history. She has deficits in greater than 2 areas of her cognition. She has gradual worsening impairment. She has a decline in her house and financing. She's got an MMSE score of 14. So what are my differentials? She's also got multiple comorbidities. She has paraphrasic and disorganized thinking, which also can be described in schizophrenia and schizoaffective disorder. It also could be due to depression, anxiety, which is causing the slowed cognition. And then also in older adults, it could be an acute illness. So we would definitely need to do testing prior to her coming in to make sure she's not having an acute UTI or dehydration. So we would definitely need to do a medical evaluation prior to being treated for psychiatric issues. So based on my research, I have learned that Alzheimer's disease is a progressive disease that involves the damaging and killing of nerve cells that impacts the individual's learning and memory capabilities and can cause mood and behavioral problems. The number one risk factor is age, and there are several modifier risk factors that could help prevent Alzheimer's. We also learned the clinical manifestations of Alzheimer's and the diagnostic criteria for the disease, and the treatment options including medications and evidence-based practice engagement with patients. So how does this impact my future practice? By learning more in depth about Alzheimer's disease, I can use this information in my practice setting where I work at currently. I can educate caregivers of Alzheimer's disease and their treatment options, and I will use this information when I obtain my degree as a family psychiatric nurse practitioner. By increasing the population's health literacy, we ultimately impact patient outcomes. These are my references, and you have a great day.